Question number 11, Eugenie Sage.
Tēnā koe, Mr Speaker. My question is to the Associate Minister of Health and asks, does she agree with the Canterbury Medical Officer of Health that increasing nitrate levels in Canterbury groundwater are a health risk, particularly for pregnant women and babies? If not, why not?
Honourable Joe Goodhue.
Mr Speaker, I thank the member for the opportunity to talk about the actual magnitude of health risk currently faced in Canterbury due to water nitrate levels. Firstly, there are no community drinking water supplies in Canterbury that have unsafe levels of nitrate. Secondly, in Canterbury, the concerns are for people on their own individual household bores, and community and public health are encouraging people to test their supplies for nitrate, as there may be some that are some risk to some people. The Medical Officer of Health and his colleagues are working with lead maternity carers to make sure pregnant women and families with babies know to have their water checked if they are on individual bore water.
Supplementary.
Supplementary question, Eugenie Sage.
While the Minister says there are no community water supplies that are unsafe, is she concerned that there are at least 8 community drinking water supplies in Canterbury that now have to be monitored because their nitrate levels are more than half the maximum acceptable value as determined by the World Health Organization, compared to only 2 community water supplies that were in that position in 2010?
Mr.
Honourable
Speaker,
Joe Goodhue.
I think the point the member makes is that these particular supplies are being monitored, and I would agree that that is in fact where we should be. So these particular supplies are at 25 milligrams or a little more per litre. That's the level of nitrate in the drinking water that triggers the monthly monitoring, and it is in fact the essence of the issue that we are monitoring them. None of these particular water supplies are above the maximum allowable value, and that is the point to make.
Supplementary question, Eugenie Sage.
Does the Associate Minister think it is acceptable that Canterbury midwives have to advise expectant mothers to test their drinking water because her government has failed to stop the pollution of our groundwater through agricultural intensification?
Honourable Joe Goodhue.
I absolutely reject the assertion of the member. It is under this very government that in fact we are working to clean up fresh water, and the announcements of the Minister for the Environment today certainly underline that at long last governments are grasping difficult issues. In the meantime, I think it is entirely responsible that midwives are giving correct and timely advice to women who are pregnant so that they can make sure they understand any risk that occurs for them.
Supplementary question, Eugenie Sage.
How many more wells and community drinking water supplies will need to have elevated nitrate levels before her government reconsiders its promotion of large-scale irrigation, intensification of agriculture, which causes nitrate leaching and pollutes our drinking water?
Honourable Joe Goodhue, and as far as she has ministerial responsibility.
Mr. Speaker, it is absolutely important that as a public health measure we continue to monitor nitrates and other things that are in our drinking water. That is the action this government is taking. The member is perhaps being a little creative to suggest that only agriculture is causing the nitrates.
Question number 12, Honi Harawira.
Tēnā koe, Mr. Speaker.
Tēnā koe.
To the Minister of Finance, what is his budget plan, if any, to immediately address growing poverty in New Zealand